Hello, lovely. Nice to meet you. I'm Dr. Nicola, your ENT specialist. So, my love, just pop your name down. Just confirm it for me. Okay. And your date of birth. Thank you. First line of your address. And a postcode. Okay. Can I have a contact number for you? Excellent. Thank you. So, I've got your referral here. Alright, so you're having regular achy throats. Okay. 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 Right. If you, in your own words now, can just describe to me what's been happening. Okay, so when did you notice all this start? Okay, so about 6 months ago. Okay, what started exactly? What made you feel concerned? Okay. Was that both ears or one? Okay. 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 Has that been causing any dizziness and any headaches? Okay. That's fine. So, achy throat. If you could just describe to me what it feels like and whereabouts. Okay, so are we looking about here? Or further back? Okay. Okay, so if we put them there. Okay. Does it feel sore? Like you have a sore throat, or how about swallowing? How does that feel? Uncomfortable? All the time? Okay. Okay, so that's that. Swallowing, uncomfortable, aches, voice cuts out occasionally. When you say occasionally, how are we talking? Once every so often, or? Okay, so that is quite a lot. Okay. Do you get quite dehydrated easily? Would you say you get enough fluid? Okay. Have you had a cough at all? None at all. Okay. And what about any cold symptoms or flu symptoms? Okay. That's fine. So you didn't have a cold or the flu or anything that's triggered this off? Right, okay. So when you say that your ear kind of pops, it goes muffled, is that right? Okay, so you're talking, you're very and you'll just stop and nothing will come out. Okay, and then with the ear, it will like sort of pop, but go really muffled and you can't hear outside that ear, and it kind of, does it ring and things and buzz then? Yeah. Does anything trigger that off, do you think? No, you're aware of. Okay. Right. I'm wondering if they are both linked or whether you've just got two issues and they're playing up at the same time. Okay. So, have you recently had an eye test? Okay, and how was it? Okay, so they've got no concerns there at all. Brilliant. No concern. Nice. Okay. How's your general health? All good? Okay. Do you take any medications? Okay. Is that all of them? Okay. Do you have any allergies? Okay. Right. Do you drink alcohol? Do you take any recreational drugs? Do you smoke or vape? Or have you ever smoked or vaped? Okay, that's fine. Right, in your family, do you have a history of tinnitus? Oh, you're aware of, okay. What about throat cancer? Okay. I do have to ask these questions, so please don't be alarmed. All right. Let's have a look at your eyes this moment. You do seem quite puffy under the eyes. Have you always been that way, or so when did you think that started? Okay. Do you suffer with hay fever at all? Okay, a little bit. Okay. That could be why you're puffy then. The eyes. Okay. We'll just have a look there when I assess you, okay. Okay, so any other symptoms or things that you think I need to be made aware of, even if you think it's not necessary, it might be, okay. So, for example, do you suffer with ulcer a lot? Okay. How are your teeth and gums? Are they all right? Have you recently been to the dentist? Oh, good. We're all on full with all the checks. And yeah, all good? Okay, brilliant. So, dentist. Okay, that's fine. When did you last have an earring test? Do you know? Probably can't, yeah, I can't remember, so that's some time ago then. Are you having any kind of hearing loss that you're aware of? Okay, so when it goes muffled up, yeah. What about anything else? If you're struggling to hear things, aren't things as clear as they were before, or are you finding yourself going, what did you say, or excuse me, or things like that a lot, or people are saying, you know, you can't hear anything, are you turning things up more, anything like that that you may have noticed if you really look and, yeah. Okay, we should pop that down. Doctor had a look in your ears. They said they looked fine, so no infection or anything like that. Now, I can't see anything written here to say that you had your ears syringed or cleaned or anything like that. Did you not have that done? Okay, and I can't see any blockages. Okay, I will have a look, don't worry. Okay. Good. So, do you get any hay fever symptoms, do you think? So, you sneeze, itchy eyes. Yeah. Your nose. And you can get headaches sometimes, yeah. It's a pretty typical hay fever symptoms. Do you take anything for that? You keep forgetting. Okay. Well, that's one thing that I do recommend that you do is sort your hay fever out. So get something. Are you prescribed anything or not? Okay, I'll prescribe it for you. Okay. And I put it in the report to your doctor. So then you can get them regularly over on prescription. All right. So do that on the prescription shortly. Okay. Okay, so what are your concerns? Is it become just annoying? Is it, you know, you're worried about something? Or, yeah, I can understand that. I know. But don't worry, you're in the right place. Okay? Okay, a couple of things in mind, but I want to have a look first and then I can go from there. Right. Just going to have to put some gloves on. Okay. Right, what I'm going to do first, I'm just going to have a look at your face, okay, and feel around your sinuses, your jawline and your glands, and down on your throat, okay. If you do feel any discomfort, I need you to let me know. Okay. Right, I'm going to have to come quite close. Okay, good. So, just have a look. Okay. Very puffy there. Okay. Okay. Any pain here? Okay. Any pain there? Okay. your head for me. Okay. Relax. Any pain here? Okay. Can't see any swelling in the cheeks, in the chin, the mouth, forehead. All looks good. Now I'm going to feel right round here. Okay. Any pain at all? Okay. Just open your eyes wide for me. Look up. Down. Okay, back at me. Look to your left for me. Okay, to your right. Okay, back at me. Okay, slightly a little bit red. Are you sleeping okay? How many hours a night? Okay. Okay then. Okay, work my way down to your throat area now. Okay. I'm going to have to squeeze quite tight, okay? Any discomfort? Right. It's a bit swollen there, actually. Can you cough for me? And again? Thank you. I'm just going to go down slightly. going to have a look at your nostrils now. Okay. Alright. If I can get you to tilt slightly, it'll make it a little bit easier. Okay. Thank you. Perfect. Okay, can you take a big sniff for me? Okay. And sniff out with your nose. Good. Same again. And the other way. Thank you. Okay, relax. I'm going to take a swab. Your nostrils. Tilt your head slightly. Thank you. Okay, thank you. Okay, so perfect. That's one done. Okay. If I could get you to just open your mouth wide as you can for me. I'm just going to have a look. Tilt your head back slightly. Okay. Just going to pop my light in, okay. Right, I'm just trying to have a really good look at the back of your throat, okay? It looks quite red. Not showing signs of tonsillitis though, which is good. It's not really excessively red, so I'm not concerned about infection. Just pull your cheek. Got an ulcer there. It's quite a large one. Okay. It's alright that side. Stick out your tongue for me. Bit of a crack there down the middle. Probably just been a bit dehydrated. Roll your tongue up for me. Okay. And back, I need to look at the roof of your mouth. Okay, back at me. Okay. I'm going to pop this compressor on your tongue. Okay. Can you say R for me? Good. Okay. Relax for me a moment. Right, I'm going to take a swab from your throat, okay? So I'm going to have to go right the way back. And then I'm going to take one from your mouth. Okay, you ready? All I need you to do is just sit there with your mouth open, as wide as you can, and just keep it open. I'm just going to take swabs from right the way round the back. Okay, thank you. Okay, we're right the way back. That's it. You do really, really well. I know. All right, all right. It's perfect. You can relax. All right. Good. No, it's not very nice, is it? I understand, but you did really well. Okay. And now I'm just going to swab your mouth. Just keep as wide as you can for me. Thank you. So I'm going to go on the tongue, under the tongue, roof of your mouth, the sides of your cheeks. Perfect. Great. That's swabs taken. Now, I'm going to have a feel in your mouth. I'm just going to pop a bit more sanitizer on. Okay. I'm going to feel around your mouth, okay? Okay. Open wide for me, thank you. Right, I'm just going to feel your tongue, okay? A little bit lumpy down the side. And that side. Did you get a lot of ulcers there? Okay. Lift the tongue up. Okay. Okay. Open wide and tilt back for me. Okay, I'm just going to put my fingers right to the back of your throat and just have a feel. Yes, I know. I'm sorry. Alright, just keep breathing. Keep breathing. Alright. It's okay. You can relax. Alright. Well done. I know, it's not very nice. Right. Now, I'm going to have a look in your ears. So, do you know when you last had a blood test? Okay, and they said no action. Okay. I might get you to have another one. There's a couple of things I want to test because of the ulcers. So. I'll get your doctor to do that for you. Okay. Okay, so that was fine. Opening. I can't see anything obvious. Okay. I'm going to check your ears. Okay. And then I'm going to discuss a few things with you which I think we need to do. Alright, but let me just have a look in your ears first. Okay. Okay. Look straight ahead for me. Thank you. going to have a feel around the back of your ears. Any pain? Okay. Okay. Close your eyes for me. I'm going to whisper something in your ear. Can you just repeat that for me? Okay. Coconut. Chocolate. Raspberry. Strawberry. Pineapple. Relax. Smile. Sleep. Yeah. And same again the other side, alright. Relax. Sleep. Pineapple. Chocolate. Coconut. Tingle. Sleepy. Okay. Put my hands either side of your ears, and I want you to tell me which side you heard a sound. So it's going to be, okay? And then you just tell me which side. Close your eyes. Okay. Good. Say something else, and I want you to copy it. Hello. Coconut. Smile. Sleep. Sleepy. Gloves. Sausages. School. Relax. Okay. And take it down a little bit more. Okay, please relax. Right, my lovely, where are we at? Okay, I don't need to do any more tests, alright? Not today anyway. Okay, so let me sort this out. I need a description. I can't see any obvious going on at all. Okay, so in general it all looks quite healthy and quite good. Okay, but we obviously have an issue here. Okay, so I'm going to give you a prescription for some antihistamines. Okay, take these once a day in the morning. Every day, please. Okay. Give you 30 days worth. Okay, so that's going to cover your hay fever because I do think you are struggling with hay fever. I'm thinking that is causing the puffiness and the sort of the red eyes, the watery eyes and things like that. Okay, yeah, so I'm hoping that will sort it out. The doctor could have done that for you, but yeah, don't worry about it. Okay, so I'm going to do that. I'm going to book you a hearing test. Yeah, okay. Because I'm a little bit unsure on your hearing at the moment. I'm wondering, because you've described a little bit of hearing loss, and when I was whispering close to you and further away and which side move and things like that, there was a little bit of confusion. Same when I asked you to repeat the words, okay? Your ears look perfect. I can't see any signs of an infection. There is no wax built up or nothing like that. I'm really impressed with that. So I wouldn't say going ahead and do an ear cleaning if it's just going to make it worse, because it could do, and we don't really want to mess with anything. However, if you do want to try something, I recommend that you go and see somebody for hoppy ear treatment. Okay. Yes, so hoppy ear candles, they pop a candle in one side and funnel it through, same with the side, and obviously they massage it all around and things like that. That will draw out any impurities and things naturally. Yeah, well, instead of putting liquid in and oil and all sorts of things and drawing it out with your cleaning, I think that's going to be just a bit too much for you. And because there's no build up or impact of any part of the ear. Yeah, so if you look at this ear here, okay, so see, this is your ear, not yours, but you know what I mean. So you've got your ear here in there. So here is perfectly clear. There's no dryness, no redness, no nothing. And if you go further in, which will bring you in to here where you can see, like so. Okay. So if you're going down here, I can see through here. A lot of the time wax gets built up here, okay, and it can get packed, more impacting further down and block up like the eardrum and cause all sorts of infections and all sorts of things like that, and we don't want that. But I can't see anything here at all. And I did try to look right the way through, and there's no signs or anything to suggest to me that further down is blocked. Okay. So I'm not concerned about that. It all looks clean and healthy and all looks really good from what I can see. I'm not, worried about that. I am worried though, the fact that I'm wondering if your hearing is the issue here. Okay, so that, we wouldn't be able to see your hearing loss. Okay, we wouldn't see that. So if there's no obvious signs of wax build-up, then my first thing would be, okay, we need to get your ears tested. Okay, so that's what I'm going to arrange for you, just to make sure. Okay, I'm going to book you in for a camera. Now I know that sounds really drastic, but let me explain. So the camera is very, very small, and I'm going to put it up your nose, down the back of your throat, and then you need to swallow it. Okay, but it will stay here. It's not going to go in your stomach. Okay, and I'm going to have a look round. Yes, you will be awake, and it just will be in my office here. Yeah, I know I get asked that all the time, but it's fine. It's pretty quick, and it just gives me an idea if there's any blockage or any swelling or any obvious things that shouldn't be there. And then same in the throat. Yeah, basically. That will give me a good look at what's happening. Okay. We may have to do further ones down the line and, get some, further tests and bigger cameras and things like that. But what it will do, it will be able to show me your larynx, your trachea and everything, and see what's going on. And I'll be able to have a good look around the tonsils that way and everything as well. But I don't think it's anything to do with your tonsils at all. I have my suspicions in mind. I'm not concerned, as in, I don't think it's life-threatening or anything like that. So please don't think that. I'm just wondering, if you've got any narrowing of your larynx and your trachea. And it could be a possibility of a build-up of tar and things like that. Yeah, that's what I'm wondering, and I'm thinking that could be causing your problems, and they are sort of linked. And to me, I have an idea that I'm thinking you've got tinnitus, okay, and that's what the ringing and the popping sensation is, and it's all sort of linked together. So if I can put these tests into place, get them done, I can analyse it all, and then I can come up with something. Yeah? Okay, good. So please don't be alarmed by that. Okay, so hearing test. It'll be a full hearing test, okay. I'm going to give you throat spray. It's a special soothing throat spray, okay. Help lubricate your throat, okay. Help minimise any swelling or any discomfort for you. All right. So I'd say just use that once a day for now. Okay, and whenever you like. So I'll give you that on prescription. Okay. Then I'm going to book you in with me to have your camera done. Okay. So there is your prescription for your antihistamines and your throat spray. Okay, get them as soon as possible, and try to start taking them, because the antihistamines is going to control the hay fever. But depending on the time of year, you may not even need to take them in autumn and winter. It might only be certain times in spring or summer. Yeah, so just, you monitor that yourself. But I always say for people that suffer with hay fever, they need to start it, say, early spring. If they suffer, say, February, start taking it January. If they suffer like March onwards, just a month or so before you would normally get your symptoms. Yeah. Also, make sure you're washing your eyes, you're rinsing your eyes, you're patting them dry, cold compress, fresh towels. If your windows are open, think about it being on the linen everywhere. Yeah. It's just minimising the, contact with the pollen. Yeah. Okay. And take obviously the antihistamines, that should do the trick. And this throat spray, it's nothing in particular. It's not really, there to like cure things or anything like that. It's just to give you a little bit of relief. Yeah, it's quite nice and refreshing, and it won't numb as such, no, but it might feel a little bit, like a little weird sensation, which is just going to help you, swallow, hydrate your throat. Yeah, okay. Yeah, let's get that for me. Right, but now I'm going to book you in for the camera. No, don't worry, don't need to, fast or anything like that. Just continue as you would normally, and I will just get you in, have a chat with you, see if you've been getting on, and then I'll just do the camera there and then. Yeah, and I'll be able to tell you there and then about things, so don't worry about that. Okay. Okay, let me look at my clinic for the cameras. Okay, it will have to be on a Monday. Would you like a morning slot or an afternoon slot? Okay, hang on a moment. What about Monday? I'm not sure on that one actually. You just check. Sorry about this. Where are we? Okay, I don't think they put it in the diary, have they? No, I didn't think they had. Sorry about this. Okay, so I can't do that day. So when can we do? The 14th, possibly the first time. Let me just check. I've only got the morning on the 14th. Okay, let me just try the week after then. Okay, I could do either 1 or 3 on the 21st of September. Okay. Perfect. Okay, so it's a follow-up and camera. Wonderful. Let's write that down for you. Okay, so there's your appointment time. Okay, so do we know what's happening then? Are we comfortable? Are we understanding? Okay, so antihistamine once every day, preferably in the morning. Okay, throat spray once a day, wherever you please. Just pick a time and then stick to that. Okay, yeah. I booked you in your camera appointment, which is the follow-up with me and a camera. I'm going to get your doctor to book you in for a blood test. The special things that I want him to look for. So I will fill out that now and I'll have it on the system so he will know what he needs to test for. Okay, it will be in my report and he'll get that. Okay. Yeah, I won't need to do that yet because if I give it you, it might go missing and things like that. Okay. Yeah, and it needs to be on the system and sent over that way. Okay. And then I'm going to have to book you an immune test. Let me just see what I've got. It won't be with me and it won't be here. I'm hoping I can get you something pretty soon, actually. Okay, it's Friday. They do only do a Friday, I'm afraid. can get you in next week though. Friday next week, morning or afternoon? Okay, in the afternoon I have a 2 or a 4. Yeah, okay, I'll do that for you. Perfect. Let's write that one down. Okay, let's do your hearing test. There we go. You will probably end up getting letters through for these appointments as well, okay? So that is routine, don't worry about that. Okay, so you've got your antihistamines, you've got your throat spray, booked your camera, booked your hearing test. Great. Blood tests, doctor needs to be informed about those. So what I need you to do is when you get back, give it about 2 days, then ring up your surgery and book an appointment for a blood test and explain that I'll be sending them over in the report, etc. Okay. Yeah, and I'll explain what you need testing for. All right. And then I want a full copy of that, but I will put all that in my report. You haven't got to worry about all these things, okay? Yeah, okay. I might at some point get you in for a scan. Okay, I'm not sure on that yet. Just want to get these results in and then take it from there. Okay. Do you have any questions? Okay. So you understand the plan and what we tend to do? Okay. Well, that's good. I wouldn't worry about it at all. Completely safe hands, and I just want to do everything as I need to do it. All right. And don't worry about it. We will sort it out, whatever it is. But like I say, I'm not concerned. All right. Okay. But give it a good gap so get all your tests in and, you know, all the results in, and then I can see you back here for results, chat about everything, camera. Sound good? Great. Brilliant. It's lovely to meet you. All right, so just carry on as normal. Okay, yeah. Just take notes on things if you've experienced something or, you know, something's concerned you a little bit or whatever. Please note it down, and then you can always, you know, bring it with you when I next see you. All right. You're welcome. You take care now. Bye-bye.